Parents, what if we told you there was a way to decrease the chances of your child developing certain types of cancer in the future? I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. Today, we're getting the facts about the HPV vaccine. Certain types of HPV are linked to the development of cervical cancer as well as several other types of cancer, but the HPV vaccine can help prevent HPV infections and decrease the chances of developing cancer. But some are still hesitant to get their children vaccinated. I'm joined today by Blessing pediatrician Charone Tolbert to get the facts about the vaccine. Dr. Tolbert, thank you for joining me today. Can you take a minute to introduce yourself?
Yes, good morning, Laura, and thank you very much for having me today. As you've stated, my name is Charone Tolbert, and I have been with Blessing Physician Services. It will be 10 years, May of this year, and I've been a practicing pediatrician for about 17 years.
Well, again, thank you so much for joining us. Let's get started with just some basic information. What is HPV and why should parents consider getting their children vaccinated against it?
Okay, so HPV stands for human papillomavirus. It's a virus that you have several different types, which you have mentioned earlier, and of those different types, a variety of different medical conditions can occur. One of the, I guess, more dangerous types would be causing cervical cancer and other types of cancers.
The HPV vaccine is proven to help prevent HPV, and that can reduce a person's risk of developing certain types of cancer. Who should be vaccinated?
We're recommending all preteens, boys and girls.
At about what age, preteen, when would you recommend getting the vaccine?
So our office in particular have been recommending vaccines around, 11 or 12 years of age, but people can get the vaccine as early as 9 years of age.
And I understand it's more than one injection, correct? Can you talk a little bit about the vaccine itself and how that works?
Yes. Yes, the vaccine usually, or I should say not usually, definitely if it's given before the age of 15, it's 2 doses. After the age of 15, it's going to be 3 doses, and it's going to be that 6 months apart.
Okay. So after 15, you mentioned after the age of 15, what is the recommendation if a person, maybe a parent has delayed or they were on the fence and now their child's a little bit older, after the age of 15, can they still get the vaccine?
Yes, they still can get the vaccine. It's just it would be within those 3 doses or 3 vaccine series as opposed to 2 vaccines.
And at that point, is it still considered to be as effective as it would be if you had gotten it older or when you were younger?
Yes, definitely.
Okay. So some parents are hesitant. Vaccine hesitancy is not anything new. So for those parents who are maybe on the fence or have some concerns, is the vaccine safe? And are there side effects that they should worry about?
Right, and those are really great questions and concerns. So this vaccine first came out to the United States in 2006, right? So we've had over, 15 years of it kind of being studied. And this vaccine, like all other vaccines, you run the risk of having some pain at the injection site, some mild redness or swelling, maybe some joint pain as well. But overall, within a day or a couple of days, those symptoms subside.
And so for parents of maybe young boys, and they're thinking, well, HPV is linked to cervical cancer. Why would I get my son vaccinated? Can you kind of talk a little bit about that?
Yes, definitely. And those are very good questions too. The theory behind that is you're absolutely right. Cervical cancer in particular, right? Boys can't get it, but as boys get older and they come into contact with other women, there is a chance if they have HPV, they could spread it to other people in their lives in adulthood. And, cervical cancer is the most common type of cancer that HPV prevents, but there are other types of cancers not necessarily related to cervical cancer that can help be prevented with the vaccine.
So maybe your son might not be at risk of cervical cancer, but he could get HPV and potentially spread that to another woman or another young lady, or also it could increase his risk of developing other types of cancer.
That is correct.
And now, what else would you tell parents who come in who are maybe on the fence about getting their child vaccinated? What advice do you like to give them?
I like to stick with the basics. I think the biggest thing, you hit the nail on the head. It's one of the, I guess, newer vaccines in comparison to some of the ones that we give infants. But, they have been studying, or the CDC has been studying patients who've gotten this vaccine since 2016, and it's been proven to be safe and still has had like great efficacy. Even, I think they followed kids up until 13 years out, and they found that it was still just as safe and just as effective at preventing HPV, and I guess in the long run and the long haul. I think, the biggest thing that I mentioned to parents is the fact that, you are potentially preventing something very dangerous from occurring, in a future, be it, their daughter or their son or daughter. I think the benefits of getting this vaccine definitely outweigh the risks of, the pain at the injection site or some redness or some swelling or joint pain. And usually if you try to put it into perspective, right, the benefits outweigh the risks, then usually parents are on board with it.
Is there anything else about HPV itself or even the vaccine that we didn't touch on that you feel is important to share? We talked a little bit about why this is important, but anything else in particular to pediatric patients?
That is a good question. I definitely think we touched on all of the, I guess, big topics, big issues and concerns. I do like to reiterate that it's ideal, right, to get this done when they're preteens, because typically after the age, kind of when you're in your 20s, right, so after the age of 15, 18, when you're off into college, you won't be able to get this particular vaccine, and you definitely run the risk of getting HPV, right, and getting some of the complications of HPV if you didn't get it done earlier. And I will tell you, I have had, go ahead, I'm sorry.
Nope, you go ahead, please.
I have had some patients, because, we follow patients, from the beginning, pretty much until they're in college and after. And I've definitely had some patients that have regretted not getting that vaccine done when they were younger. So I really think it's very important, such a small, side effect can have such a big impact, if you don't get that done.
And so I think that the takeaway is always they talk about an ounce of prevention.
Yep.
And in this case, I think that applies. I also always like to remind people that if you are hesitant, have that conversation with your physician, with your provider, ask your questions, because as you said, you're always willing to explain risk versus benefit and why it's important.
Yes, definitely. And, it's not something that we try to force upon patients. If we come in for the well visit and they decide that they're on the fence, we definitely have a conversation with them about, risks, benefits. And I even tell parents, hey, you don't have to get it done today. You go home, you think about things, you read through some of the material that we've given, and then you can always contact us anytime to get it scheduled.
Well, Dr. Tolbert, thank you so much for joining us today. I think that we covered a lot about the vaccine and about HPV itself, and we appreciate you taking time to talk with us. You can find more information on our website about the HPV vaccine, and that's at blessinghealth.org/HPV. Thank you again for joining me.
Thank you.